You're live.
Okay, thank you very much. It is Friday, May 22nd. We are convening this special meeting of the Thurston County Board of Health. By way of letting folks know, we're doing this on the Zoom platform, and I have I'm Commissioner Ty Menser, Chair of the Board of Health. I've got Vice Chair John Hutchings, Thurston County Commissioner, District 1. We have Commissioner Gary Edwards, District 2, County Manager Ramiro Chavez, County Health Officer Diana Yu, Assistant County Manager Robin Campbell, Director of Thurston County Public Health and Social Services Shelley Slaughter, from the Prosecuting Attorney's Office, the Attorney for the Board of County Commissioners and Board, Elizabeth Petrich, and then we have Clerk of the Board, Lydia Hodgkinson, if I'm correct about that final block. I see nodding heads. Okay, we have special meeting today with a couple of key items, and I'll be first looking for an approval
Commissioner,
of the.
can you give us just a second until we have a little blip on the
Yeah, can you hold for just a second?
on the live stream,
Okay.
please? Sorry about that.
I don't know why this sounds not on.
For those who can join the conference call, can you please mute your phones?
Is there a number I need to announce, Ramiro, regarding call-in access?
I counted probably 5. They have joined in.
Do I need to state that number over the?
Yeah, do you have it with you?
I do not have it right here.
It's 360-252-9020. And the PIN number is 1234.
You're good, you're on.
Okay,
Okay, we're back on.
do I need to start back from the beginning or?
Yes, please.
Okay,
Yeah.
all right, let's start again. It is Friday, May 22nd, 2020. We're convening a special meeting of Thurston County Board of Health. My name is Ty Menser. I am Chair of the Board of Health.
Joining the conference.
We have some folks, we have public access through telephone. The number is 360-252-9020. That PIN number is 1234. Again, 252-9020. And we do have some folks joining by telephone, but within the virtual meeting room, we have Vice Chair of the Board of Health, Thurston County Commissioner John Hutchings. We have Thurston County Commissioner Gary Edwards, County Manager Ramiro Chavez, Assistant County Manager Robin Campbell, County Health Officer Diana Yu, Dr. Diana Yu. We have Public Health and Social Services Director Shelley Slaughter, Prosecuting Attorney Elizabeth Petrich, and Clerk of the Board of Health Lydia Hodgkinson. A couple of key items for today's consideration in the special meeting. First item would be to look at an approval of the agenda.
Mr. Chair, I move to approve today's agenda for the special meeting.
Second.
Okay, I have a motion, I have a second. Any discussion about the agenda?
No, sir.
All in favor, say aye.
Aye.
Aye. Motion carries and the agenda is approved. Second item on today's agenda is an opportunity for the public to address the Board of Health. And
I can probably open the conference call if somebody likes to join in and provide some feedback.
how will I know if somebody wants to do that?
I will cue you.
Okay.
I hear none.
Okay, so we'll move on to department item 3 on the agenda, recommendation of variance to phase 2 of Safe Start Plan. I'm going to turn this item to Director Shelley Slaughter.
Good morning, Commissioners, and I'm actually going to defer to County Manager Ramiro Chavez to give you some background on this.
Joining the conference.
Thank you, Shelley. Thank you, Commissioners. And let me frame the item for you this morning. Let me give you a little bit of a background. Let's just start with February 29, 2020. The governor of the state of Washington issued proclamation number 2005 proclaiming a state of emergency for all counties throughout the state of Washington. He followed up on March 23rd, 2020, extending a state of the emergency and establishing the stay-at-home order, which at that time have an effective date of April 6, 2020. On April 2nd, 2020, the governor announced a month-long extension to the stay-at-home or stay healthy order. They extended to May 4th, 2020. On May 1st, 2020, the governor announced the extension of the stay-at-home order until May 31st, 2020, and provided the Safe Start Washington, which is a phased approach of recovery as to how the economy in the state of Washington can start opening. During that time, he also allowed 10 smaller counties to apply for a waiver as to how they can move from phase 1 to phase 2. Also on May 19, 2020, the governor continued to outline the circumstances in which other counties can use a different criteria as to how they can move quicker from phase 1 to phase 2. This new criteria offered on May 19, 2020 included those counties who had fewer than 10 cases per 1,000 residents over a 14-day span could apply for a variance allowing to move into phase 2 of the Safe Start approach. At that point, based on the data that we have received in Thurston County became eligible this week, and this is the purpose of the resolution. There are a couple of steps that Thurston County needs to meet in order to move into phase 2 via an application. We need to apply to the state of Washington, and it requires a couple of steps. It requires the health officer, in this case Dr. Diana Yu, has to review the guidelines the governor has provided, and also she has to provide a recommendation to the Board of Health, which she extended a letter to you dated May 20, 2020, in which she recommends for you to consider the county moving into a phase 2, phase 2, including all modifications, including in the governor's plan. The next step in the process, after Dr. Yu has provided the letter, the Board of Health may choose to move forward by concurring with the recommendations of the health officer. And this has to achieve a majority vote of the Board of Health. Soon after that, then the Board of County Commissioners must vote on the Board of Health plan and to fully participate and meet the requirements of phase 2 of the governor's order, of the governor's plan. And the Board of County Commissioners cannot make any modifications to what the Board of Health may be approving in today's agenda. So that is really the framework as to how we have been moving into this phase 2 approach. I believe that it's a good opportunity for you to consider moving into phase 2. I believe we have all the necessary requirements to meet this criteria. And at this point, I will leave it up to Dr. Yu to give you additional perspective in terms of her letter, her recommendation, and maybe Shelley can follow up with additional thoughts.
Thank you. Good morning, Commissioners. When we received the instructions and application for the variance to the Safe Start recovery plan, and we have reviewed the criteria for application, and I believe that we fully meet the criteria for application. We have enough, we have a low caseload that's under the number that they're looking for. We have testing capacity. We have the capacity to do more and have enough personnel to do case and contact investigation. using the protocol that was provided by the Department of Health. I think it is very important for everybody to continue to realize that we still will need to continue social distancing, hand washing, wearing face coverings when we're out in public, when we cannot social distance. And the fact that the virus is still around, and that moving into phase two is it does not mean we're out of the woods. So, but I think that we have all the elements where we can apply for moving into phase two without any modifications to the criteria that was set for us. You have any questions?
Questions for Dr. Yu and the board?
Thank
No,
you.
I do have a statement though. I'd like to commend Dr. Yu for getting this going for us and expediting the process. Thank you very much.
I do have a comment, but not a question. May I, Mr. Chair?
Absolutely. Commissioner.
This, I don't want this missed on anybody, but today is as a momentous day as was March 12th, when the Board of County Commissioners declared and the Board of Health declared an emergency. This is the first step in that recovery. Doesn't mean, as Dr. Wood said, or Dr. Yu has said, it's not, oh yeah, everything's just fine out peachy keen. There's still concerns and we still need to be wise, but it's a momentous day nonetheless. I want to thank Dr. Yu for your tested and proven leadership through this, as well as Shelley Slaughter, our director, because we've gone from where the strange in our lives became normal, and the normal now becomes strange. And so this special meeting of the Board of Health is really, really cool, and it's not missed on me, and I don't want the public to miss that either. So thank you.
Okay, thank you. And Dr. Yu, you answered one of the questions that I had, which was just about whether or not there's some aspect of it that we need to modify, or whether we can fully go forward, and you answered that. So that's what I wanted to hear. Okay, so with that input, I believe there is a resolution then that the board has in its packet that we need to potentially take action on, correct? Ramiro?
Yeah, that is correct, and there's a motion for your consideration on your agenda as well.
Okay, so we have a motion in the agenda. We also have let's see. Yeah, to approve the resolution. So has the board had opportunity to review proposed Thurston County Board of Health resolution number H052020?
I have, yeah.
Commissioner Edwards?
Second.
Are you comfortable with the motion?
I want to get with it. You can tell. I'm in a hurry.
Sounds like we're ready for motion.
All right.
Commissioner Messer, for the public, do you want me to read the two legislative items that you might be considering approving on this resolution?
Yeah, because I don't want to read it.
No,
It's very lengthy.
just the two legislative items. I'm not.
Yeah, why don't you outline that so the process?
Yeah, because I'm not suggesting me reading the motion, no. So the two legislative items included on your proposed resolution states as follows. Number one, the Thurston County Board of Health has reviewed Dr. Diana Yu's letter and concurs in her findings and recommendations that Thurston County should submit a request for a variance from the governor's stay healthy proclamation to fully enter into phase two at this time. A copy of Dr. Yu's letter is included as attachment to this resolution. Number two, the Thurston County Board of Health approved submitting a variance request to the State Department of Health to implement all phase two modifications of the governor's state Safe Start plan, and request that the Thurston County Board of County Commissioners approve the Board of Health's variance request. And the Board of County Commissioners then would be
considering this on Tuesday morning, is my understanding.
I'm drafting that resolution for the Board of County Commissioners consideration, and yes, I do have an item up for discussion on Tuesday morning.
This is where we really do wear different hats, so I'm gonna put on my Board of Health hat
There you go.
so that it's clear what we're doing here.
Okay.
Is there a motion?
Mr. Chair, I move to approve the resolution to affirm the recommendation of the Thurston County Health Officer to apply for a variance to move into Phase 2 of Governor Inslee's Safe Start Plan.
Second.
Hear a motion and a second. Any further discussion regarding this item?
Yes.
Commissioner Edwards.
By any chance, we're talking about moving forward with the Board of County Commissioners on Tuesday. Is there any reason that we couldn't do this before then? Any restriction about weekend activity or on a holiday? The reason I bring this up is we need to help folks out, and time is money in the real world. All government employees get a paycheck every 2 weeks, no matter what. And I would just like to take every opportunity. I'm willing to work all weekend and do whatever it takes to expedite this process. So I don't know if there's a legal restriction or because we still have follow-up work to do that might need to take place, maybe with the hospital or other folks that are affected by all the criteria the governor has laid out. I'd just like to clarify, if we can, I'd like to convene an emergency board of the county commissioners. If we can't, because we're not quite there yet, I would like the public at least to know that.
Okay, is now joining the conference.
Maybe I can start addressing that, Commissioner?
Mayor, why don't you start addressing that issue?
Yeah, when we received a letter from the governor outlining the criteria that we need to meet in terms of the application is very significant. I think we need to take the time to make sure that we don't rush into an application if it's gonna be a failure. And the staff is currently working. I think we have a final draft. We need the weekend to make sure that we cross all the Ts and dot all the Is. And it is a matter to making sure that application is correct. Because it's not just about taking a legislative action. It's all the background work that needs to occur in making sure that we meet every single criteria the application requires. So answering Commissioner Edwards' question is the latter. Is we're working as fast as we can to meet this very extensive set of criteria.
Commissioner Hutchings.
I would like to add, I understand Commissioner Edwards' anxiousness about getting everything in place and getting it started, and I agree with that. And a lot of people in Thurston County are excited about, hey, let's hurry up and move that ball. But I think it's critically important that we respond rather than just react. Because I think there's a lot to lose if we don't get the other final pieces in place that need to be put in place before Tuesday. That we risk a denial from the state, and if we receive a denial from the state, that doesn't bode well. It doesn't look good either. So I want to make sure everything is completely in order. We have all the pieces of this puzzle that we have to have put together, and this is the first piece, but there's other pieces to go with it before Tuesday morning. When we submit it to the state.
Yeah, and one of the key pieces of that requirement is we need to have a concurrence from the hospitals. I believe we have received a concurrence from one, and that we're waiting to have a concurrence from the other hospital, which at least for us, yesterday we have not received that. So all that needs to take place. Go ahead, Joey.
I have not received letters from both hospitals, and we'll have a complete package for the board's review on Tuesday.
Well, that's wonderful. I mean, obviously, as soon as we heard about this earlier this week, it was projected that it might take till the end of next week, and now because we're hearing the community loud and clear, and we're working as hard as we can. Now I'm hearing that we've moved that up to Tuesday, which is great. Dr. Yu.
I just want to remind folks that we are still in phase 1 until our application is approved. So until that is approved, we are still on phase one. That means that all the phase two businesses should not be
For
operating yet.
politicians.
Just a reminder.
Right.
And it's still a stay-at-home.
Gary, Edwards calling for a special vote right now to move it forward faster.
For those joining the conference call, please mute your phones.
That was all. Just a
Okay.
reminder.
Right, and we're expecting, the state has been moving, in my opinion, very quickly on the applications, but until, things change, and until we have an approval, we're still where we are. So it's a multi-step process, step by step. We're moving it quickly. So now so with that discussion, any other discussion regarding the motion on the floor, which is about approval of this resolution with attachment
No.
No, sir.
A? All in favor, say aye.
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 Okay, that motion passes unanimously, and we have our resolution, which will then go to the Thurston County Commissioners. But not this morning, Tuesday morning, when we have a chance to review the full we believe we will be reviewing a full application at that point. Item number 4 on today's agenda is another exciting piece of business, which is announcement of new Thurston County Health Officer. Maybe Shelley, can you frame this issue?
Is now joining the conference.
Yes, thank you, Commissioner Menzer. So we have been recruiting for a permanent health officer for
Now
Thurston
joining the conference.
since December. And I'm very happy to report that we had over 20 applicants. We had 5 finalists that were selected for interviews by the Board of Health and Board of County Commissioners. There were 2 applicants, 2 top applicants, and then a final offer was made to Dr. Dimiana Abdulmalik. And I have a short bio to share about
Has left the conference.
Dr. Abdulmalik. She is scheduled for to start with Thurston County Public Health and Social Services on July 1st. She will be relocating from California, and in next month we will bring forth a recommendation for a formal appointment of Dr. Abdulmalik when all the final paperwork has been completed. But we're very excited to have a permanent health officer selected. Incredibly grateful for all of our acting interim health officers, especially for our own Dr. Diana Yu, who came out of retirement so graciously to help us tackle COVID-19 and has done an amazing job. And we still need her until July 1st. She'll be working closely with Dr. Abdulmalik to onboard her before she goes off dancing into the sunset. And we will most certainly be having a special recognition and celebration of Dr. Yu's contributions to us, especially getting us through this crisis. So if I may, I'll share a little bit of information with members of the public about Dr. Abdulmalik.
Sounds good, please do.
Okay, so Dimiana Abdulmalik is an emergency physician with a passion for public health. She attended Albert Einstein College of Medicine in the Bronx, New York, where she was on the board of the Free Clinic and spent time contributing to public health in Ethiopia. She attended emergency medicine residency at Washington University in St. Louis in Missouri, where she continued her work in public health and her work that she started in Ethiopia. She also was a global emergency medicine training fellow at Case Western University in Ohio,
Has left the conference.
where she worked with International Medical Corps on creating standards for refugee
Has
clinics.
left the conference.
Earned her master in public health. For the last 3 years, she's worked as an emergency physician at Kaiser Permanente in Redwood City Medical Center in California, and where she has been working to connect patients with complex medical and social needs in her community. She's very excited to be joining the Thurston County Department of Public Health and Social Services, and we look forward to her starting with us in July.
Thank you, Shelley. Any questions from the board about Dr. Abdul Malik? Commissioner Hutchins.
Yeah, not a question, but a comment. This is like a trifecta because it's very good with Dimiana, Dr. Dimiana Abdul Malik. It's good for her. It's good for Thurston County and for the county citizens. And it's equally as good for Dr. Diana Yu so she can get on with retirement. So I'm very pleased for Diana. I'm very pleased for Dimiana, and I'm very pleased for our community. She comes with so many very impressive credentials, as well as she has family here in Washington State. So it's good for Dimiana as well. Thank you.
Yes, there's a lot of aspects of the candidate that I was excited about. You know, she studied prior to her medical. She studied at UC Berkeley, where I studied law. So that shows really very good judgment, in my opinion. We've got. She has a public. You know, she had experience in other countries working on some public health protocols, and a very unique experience. And then the emergency medicine experience most recently. So for someone of her point in her career, she's done quite a variety of things, and I think will bring a lot of positives to our community. And it's great the way this kind of worked out to have Dr. Yu to be able to overlap and onboard her with her experience right here in Thurston County. I'm hoping it'll work, you know, very seamlessly and very positively for Thurston County. So we're going to welcome her more formally at a later point, but we wanted to make that announcement. Thank you, Shelley. And that brings us to the end of the agenda. If there's any objection or further items, I'm going to move to adjourn. Ramiro.
Yeah, I think you made a point, Commissioner Minister, that the Board of Health needs to take a formal action in appointing Dr. Dimiana Abdul Malik. And we will schedule an upcoming Board of Health meeting for you to take a formal action on that.
Sounds good. That might be at our regularly scheduled June 9th slot, or it might be at a different slot. We're still to be determined.
That is correct.
With that, this special meeting of the Board of Health is adjourned.
Thank you.
And do we